Hi everyone. What is radiology? That is my first question. You don't have to understand that, but radiology is actually the branch of medicine which deals with imaging as well as use of radiations. Why everyone is afraid of radiation? That is the first question. So I will just tell you a question. A 7-week pregnant lady underwent a chest radiograph by mistake. So what is to be done next? Okay, so your friend, imagine your friend, she got accidentally exposed to radiation, underwent an radiograph by mistake, and she's asking you, what should I do? Because I am exposed to ionizing radiation, so what should I do? Okay, I am able to see that around 98% has been given the answer of choice 4. So in radiology, in clinical practice, I will tell you the answer by the end of this chapter. And in radiology, you have to understand that we will be using X-rays and gamma rays, particularly for imaging purpose. So the branch of science that particularly uses gamma rays is termed as nuclear medicine, and we will discuss about nuclear medicine in detail tomorrow. Okay, today I will restrict towards the discussion towards the radiology part, in which we will be primarily using X-rays. That is X-rays, and the investigation that usually we will discuss will be about radiograph, that is X-rays, fluoroscopy like barium meal, barium swallow, barium enema. All those barium investigations will come under fluoroscopy. Then digital subtraction angiography, then CT, mammography, DEXA. So this is how the things will be. Okay, and coming to particulate matter, that is alpha particle, beta particle like things, that is commonly used in radiotherapy. So in radiology, that is in my branch of science, we commonly uses X-rays, and in nuclear medicine we will commonly use gamma rays. Okay, this is how the things are. And remember, X-rays are extranuclear in origin, that is they originate from the outer part of nucleus, and gamma rays are nuclear in origin. That is why the branch of science that uses gamma rays is termed as nuclear imaging or nuclear medicine. Okay, you know there is a degree like nuclear medicine. So coming to the ionizing power and penetrating power. So if they ask you all these type of one-liners, where they used to ask these type of one-liners before 2017. Okay, before 2017. After 2017, they are not asking these type of questions. Instead, they are asking all the clinical stuff. Okay, but it is always a safe practice to know the previous year questions. Okay, that is just my aim. We just need to know the previous year questions. Okay, that is the common thing. So ionizing power is the power to ionize. Okay, so the ionizing power is maximum for alpha particle, that is for the alpha particle, and it is minimum for the gamma rays. But the gamma rays have the highest penetrating power. So if you tell it to penetrate a concrete block, the gamma rays will penetrate. But the alpha particles can be simply obstructed by our shirt or a thin sheet of paper, because they are heavy particles. They can ionize, but they cannot penetrate. Okay, this was the concept. This table were asked before 2017, but it is a safe practice. You can practice and go. Okay, so okay, now coming to the department, coming to the radiology department, the first chapter, this introduction part, will be just about the radiology department and the things that are used in radiology department. Okay, so I know everyone is outside, at least the professionals outside the medical field is afraid of radiations and radiology, because when I got my seat in radiology, I made a post in Facebook. I am happy I got a seat in radiology. I am going to join the college, like that. As everyone do, I also made a post. Okay, and I was like expecting many congratulations, but for more from my relative sides, I got the message, be safe, like that. Okay, so it is there is a belief that radiology involves lot of radiation, and it actually it is true, it involves lot of radiation, but we will see how we can tackle that radiation, how we are protected, and how this radiation is exposed. All these things we will see. So okay, so I am taking you a tour into the radiology department, and in the first floor, on the ground floor of the department, you are seeing this machine. So can you tell me what is this machine? Okay, you might have seen this machine. This is the most commonly used radiographic investigation everywhere in the world. So can you comment what is this machine? Okay, yeah, this is X-ray. So how you get an X-ray? So you will ask you when you are a physician, you are practicing in the general medicine or surgery, and you want an X-ray done. So what you will do? You will write in a requisition form to take a chest X-ray PA view or X-ray abdominal rect view like that. So imagine you are given an X-ray. So what the technician will do is he will position the patient here. The patient will lie in this couch like this. Okay, and what happens is when the technician presses one button here, X-rays will be coming like this and you will get the image. An image plate will be there, you will get the image. So basically the technician in charge has to press one button. He will just press that button and X-rays will come out. Okay, this is how the things will happen. And how the things work is when he presses the button, the current electrical energy passes through the cathode and it will release electrons. So the cathode will get it heated up. The heated up cathode will release electrons. Simple principle. These electrons will travel into the anode. See, this is the anode. Okay, the electrons will travel into the anode, and these electrons are stopped here, and the kinetic energy of the electrons is converted into X-rays. So the theory part is very simple. You just have to press one button. Whenever you press that button, the cathode part will get heated up. The heated up cathode will release electrons. These electrons will travel from cathode to anode like this. The electrons are stopped by the anode, and that anode from there the X-rays are released like this. So you got the part right. So just by clicking a button, these things happen. So these X-rays produced, there are two types of X-rays are produced by this procedure. One which starts with B and another which starts with C. This one which starts with B is called as Bremsstrahlung radiation, and this one is called as characteristic radiation. Okay, so two spectrum of X-rays are produced when the technician presses that button. What is Bremsstrahlung radiation and another characteristic radiation. And in our routine practice, this Bremsstrahlung radiation is the most common part. Around 90% of the X-rays produced are by this Bremsstrahlung spectrum. Okay, so this was a question which was asked previously. So this is one previous year question, and another previous year question is, which among these parts is rotatory, whether the cathode is rotatory or anode is rotatory. So the answer is we are using a rotating anode. So anode is the rotating part. So this is another previous year questions. So from X-ray production, the two previous year questions after 2017 is, which of the following is the rotating part of an X-ray tube? So the heart of an X-ray machine is the X-ray tube. So this is the X-ray tube, and in this X-ray tube, the cathode is a stationary part which is made up of tungsten. Cathode is made up of tungsten. Anode is also usually made up of tungsten, and this anode is rotating anode. So these are the three questions which has been asked from X-ray production. Okay, so if you know these concepts, you can easily make this question correct. I hope this is very clear. Okay, so simply by pressing a button, the electrons will flow from the cathode to anode, produce two type of radiation. One is called as the Bremsstrahlung radiation. Just remember the radiation that starts with B, and there is characteristic radiation. Okay, and the anode that is used in an X-ray tube is a rotating anode, not a stationary anode. It will rotate like a fan. It will rotate like a fan. Okay, that is what it happens. Okay, so I demonstrated you the X-ray room. Just immediately near to the X-ray room, there is another room. Okay, there is another room. So can anyone tell me what is this machine? What is this machine? Feel free to tell. Okay, because here you can make any type of mistakes. I was worse than you when I was in your position. Okay, excellent, excellent. You know, this is mammogram. How you find out it is a mammogram? What made you feel that this is a mammogram? See this paddle. You should know how you take a mammogram. Just simple thing. The female will stand like here. She has to keep her breast here and it will be compressed between the paddles. The breast will be compressed between the paddles, and similarly the tube will produce a X-ray. When the technician presses the button, the tube will release X-ray. Same principle. So mammogram is an investigation which uses X-ray. First point, it uses X-rays. First point. So remember, mammogram is usually done after 30 years of age for screening of breast cancer. That is a very important MCQ, and you have to know that. And my question is, see the woman, there are lot other modalities like ultrasound which is painless, MRI which is painless, CT or plain radiograph. There are a lot and lot of investigations. Then why mammogram? Why you have to compress the breast, take radiation exposure and take an image? What is the importance of mammogram? Why you are doing mammogram? Because it involves pain, because you have to compress the breast. In young females, the breast will be very dense, so they will be having some pain. And also you are using X-rays. You know X-rays are ionizing radiations. X-rays are ionizing radiation. So can anyone tell me, can anyone comment why you have to go for a mammogram? Excellent, excellent, for looking for calcification. So the thing about mammogram is a modified version of X-rays. So the some differences are there. Here, all these differences are questioned. Here the anode is not made up of tungsten, but the anode is made up of molybdenum. Here the anode is made up of molybdenum. One MCQ. Just you have to write down these MCQs, because these basic concepts are very important for the exams. Okay, so these are very important. First difference is its anode is made up of molybdenum. Second difference is, I told you there are two type of radiation involved in a normal X-ray: Brunstad radiation and characteristic radiation. See, mammogram uses only characteristic radiation. Only characteristic radiation is used in mammogram. It is for finding out micro calcification. As Dr. Whom Preeti told, okay, it is used for finding out micro calcification. So I hope all of you are aware of BIRADS. BIRADS 1, 2, 3, 4, like that. Okay, I hope all of you are aware of BIRADS. So if you are seeing a micro calcification in a mammogram image, which BIRADS you have to give? I will give you the option: BIRADS 1, 2, 3, 4, 5. Please comment 1. You are picking up microcalcification with the help of mammogram. Then which BIRADS will you give? Options are 1, 2, 3, 4, 5. Okay, Dr. Jittu has told 4, Preeti 3, okay, Ramasubramaniam 4. Excellent. Okay, so if you are getting microcalcification, it is BIRADS for A, B or C. Okay, we will discuss that in detail in women's imaging. It is very important, but you should have a concept. Okay, you should have an idea that microcalcifications are usually neoplastic or malignant in etiology. So these are the basic. So only to find out this microcalcification, and because the lesions will be evident in ultrasound also, can be seen even in a CT or MRI also, but microcalcifications are picked up only with the help of a mammogram. That is the concept. Okay, that is the concept of mammogram. Okay, now coming to the two machines. This is a CT machine, this is an MRI machine. So now I will ask you the questions, because I am introducing you to these two rooms. I am showing you the two machines, and I am asking you, which of the following, that is in CT and MRI, which involves ionizing radiation and which does not involve ionizing radiation? You tell me, I will write it down here. Excellent, excellent. You guys know that CT involves ionizing radiation. I will ask you a simple logical question. X-ray, mammogram, CT, which involves highest dose of radiation? CT. Yeah, CT will be having around 10 or 20 times more than an X-ray. Yeah? More than X-rays. More radiation than X-rays and mammogram. That is the concept. So, which radiations MRI use? MRI uses which radiation? Whether MRI uses gamma rays, X-rays, alpha particle, beta particle, gamma particle, what? Which MRI is basically making use of which principle? Any idea? CT, everyone was very enthusiastic. Every one of you were commenting CT ionizing. So please tell me about MRI. Yeah, Preeti again told it is. Yeah, Hritesh. Okay. So MRI is basically magnetic resonance imaging. It is magnetic resonance imaging. It uses a magnet, and I will just simply brief you the principle when you are discussing MRI in detail. Okay. Now I will give you some clinical scenarios. You are just think you are getting MS General Surgery or MD General Medicine or Emergency Medicine or Pediatrics degree next year. After attending my class and you are getting good ranks, okay, and you are sitting as a medical officer, as a JR, first year JR in the casualty. Immediately, a 27-year-old male is brought to you. 27-year-old male is brought to you with RTA. His GCS is 6 out of 15. So, only radiological investigation. Which will be the preferred radiological investigation for the patient? Yeah, excellent, excellent. Yeah, from Preeti, everyone, Shiva, and okay, I may not able to read out your names because you are answering very fast. Okay, you are going for a CT. Excellent. Again, a 25-year-old pregnant female. My question is, a 25-year-old pregnant female is brought to the casualty after an RTA. You are suspecting hemorrhage because her GCS is 7 out of 25. 15. She is having very poor GCS. Now, which investigation will you prefer? Because you are suspecting an intracranial hemorrhage in a 27-year-old pregnant woman. Why MRI? Everyone again suddenly shifted to MRI. Why? See, if you have a choice to save the life of some person, whether you decide to save the life of a person who is alive or who is going to be alive, okay, you have to save the life of mother. So you don't have time to take an MRI if the bleed is very high because GCS is poor. Okay, MRI can also pick up bleed, but CT will be excellent in picking up bleed, and it takes just 1 minute for scanning. That is the common thing you have to understand. MRI will take about 20 minutes. So which one do you want? Do you want a scan that goes for 20 minutes so that the patient can aspirate something, or so that the patient will get expire within the couch itself? Okay, because see, when I was doing my first year residency, I was in charge of MRI. I was the MRI PG, and what happened is there was a patient there. And when the scan started, he was a little bit restless, and towards the end of the scan, he was lying free. No artifact were there, but the signal of the brain was different. I was not able to see any vessels in the brain. I was thinking, what is happening? Okay, after the end of the scan, when we took out the patient, that's all, he expired there. Okay, because it takes some time, and when the patient is very unstable and all, it is very difficult to perform an MRI because things like this can happen because it takes around 15 to 20 minutes to complete. So things like, then what I did is I silently shifted the patient to the ER without telling anyone. Otherwise, they would have hitted me. So things like this can happen. So whenever there is an acute emergency, it is always better to go for CT. But this is just for a practice. We will see more case scenarios as we go along. Okay, when we discuss CT and MRI, I will tell you more scenarios. You have to diagnose it. You have to tell it as a doctor. Okay. Now, this is again the questions which were asked before 2017 when I was preparing, when I was attending classes like you. These tables were very important. Okay. So for all the radiation, there will be two types of unit. One is conventional units, just like any other things in physics. Okay, they will be having two units, right? Conventional unit and SA unit. Similarly, the radiation doses will also have one conventional unit and another SA unit. Okay, just leave apart radioactivity. Give this for nuclear medicine. Okay, actually I am not a very big fan of nuclear medicine because I am a radiologist. Okay, so just leave that apart. Other things I will make you clear easily. All the conventional units will start with R. So in exam, don't confuse conventional unit with SI unit, because all the conventional units will start with the R. That is the first important thing you have to remember, because in exams you may get confused with rad, rem, rongen, like that. Okay, so and when in exam they will give rad, Gray, Sievert, Curie, Coulomb, like that. So if they are asking for a conventional unit, you have to pick one option that starts with R. So R is the most important part. Radiology itself starts with R. And coming to the SI unit, all the SI unit will be names. See, Coulomb is a name, Gray is a name, Sievert is Gray's Anatomy, you might have seen, Sievert, Becquerel. All SI units will be based on names. Okay, so this is how you can easily differentiate between a conventional unit and SI unit. If you got that simplified version, please give me a hands. Okay, because then I can move on to other mnemonics. Okay, so if conventional unit they are asked, pick something that starts with R. If they are asking you for an SI unit, pick a name like Coulomb, Gray, Sievert, like that. Okay, and coming to the absorbed dose has A, rad has A, Gray has A. So that is very simple. Okay, absorbed dose, everything will be having A. And for our luck, effective dose and equivalent dose has same unit. Everything will be having E. Again, Sievert will be having two E's, E. Okay, so for effective dose or equivalent dose, if they are asking, select something with E. Okay, so in exam, even if you get confused, you can easily make the question correct. If they are asking for the conventional unit, select that starts with R and having E, and which is having E, that is REM, R and E. Okay, so this is how you can study that. So the table is very simple. If you know the concept, then nothing, it is very simple. But unfortunately, these things has been asked only before 2017. After 2017, questions like this is coming. Okay, if you got the concept, I will skip the table and I will move forward. Please, you have to show me some symbols, okay, in chat. Or if you want me to tell this again about R, A, E on names like Sievert, Gray, then I will tell that again. Okay. 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 Some of you are telling yes. Okay. I hope this is very simple. Okay. Now, so we entered the radiology department. We saw the X-ray machine. We saw the mammogram machine, CT machine, MRI machine. Okay. And you are writing. And you suddenly saw some JRs and technicians wearing these things. Okay. I told you, right? When I got into radiology, most of my relatives, my mother's relatives, my mother's brother, everyone were terrified, telling why radiology you could have, you can take medicine, you can take, then become cardiologist, you can make or take orthopedics, and like that radiology is problematic, like that. Everyone were telling that. And so how this radiologist or interventional radiologist or interventional cardiologist or an orthopedician who is working in a radiation setup is preventing themselves from radiation? It is with the help of radiation protection device. It is with the help of radiation protection device. So one of the important radiation protection device is a lead apron. So you will be seeing a lead apron. So you might have, or surely you will be seeing that in the orthopedics OPD. Okay, whenever you are handling the CM, because when you are intern, you will be handling the CM, you will be shooting the X-rays with the CM, right? Every one of you might have done that or seen that. Most of you have worn that. So this is a lead apron. So as the name suggests, it is made up of lead. Okay. Where all you can put a lead apron? That will be my next question. Have you seen what all lead aprons you have seen? This is an apron that covers the entire part of the body. So you can wear it as goggle for the eyes, apron for the body, cap for skull, gloves for fingers of wrist, like that, because interventional cardiologist, interventional radiologist will be having their hands also exposed. So there are multiple variants of these lead aprons available to protect ourselves from radiation. Okay, so from which radiation these radiation protection devices will protect you is it mainly protects from the scattered radiation, because the primary radiation is intended to the patient, because we want to expose the patient, because the patient is the one who is undergoing this investigation or procedure. So the primary radiation will go into the patient no matter what happens. We have to get we will not be encountering the primary radiation, because we will be putting the clicking the button, or we will be seeing the procedure, or we will be doing the procedure. So primary radiation is for the patient. It is not for the radiologist or cardiologist or an orthopedician working. Okay, it is for the patient. So we have to get protected from the scattered radiation. So a radiation protection device will protect you from the scattered radiation. This is one INI-CET question. It protects you from a scattered radiation mainly. And these aprons will be usually having 0.5 or 0.25 milli equivalents of lead. Only 0.5 milli equivalents of lead. Okay, so it is a very small quantity, right? Why can't you make it 5 or 50 or 100 milli equivalents? Anyone tell? Can anyone tell why they are making it only with a 0.5 or 0.25 milli equivalents of lead? Any idea? Yeah, excellent. Because if you have worn that lead apron in orthopedics OT, you might know it will be very heavy. Even 0.5 milliequivalents of lead is very heavy. So if you make it 5, then the doctors will be like this. You cannot even stand. Okay, so it is very unpractical. And this 0.5 milliequivalents of lead is well good enough to protect you from this. And now coming to the other part. So how you can understand that how much radiation I have received in my last 3 months or 4 months or 1 year? How you can tell? Because excellent. So because all these are the previous year questions, and you know the questions. If you know the previous year questions, if you know the previous year topics, then that is the foremost important thing in preparation. Okay, so whenever I teach, I tell you, when you enter into the entrance practice, you have to understand that previous year topics is the area which you can never leave unattended. If you go without knowing previous year topics, then you stand a very less chance to get a very good seat. Okay, but if you are strong in the previous year topics, then you stand a very good chance. Okay, so in my session I will be covering all the previous year topics. I will cover all. Previous year questions are not that important, but previous year topics are very important. This lead apron is a previous year topic, as she told. Okay, Preeti told. TLD is another very important previous year topic. So TLD, what is TLD? This is actually a badge. This is actually a badge called as TLD badge. This badge, TLD means thermoluminescent dosimeter. It is called as thermoluminescent dosimeter. So they will give a badge like this, and we have to wear this at the level of chest when you are in the department. When you are in the radiology premises, you can keep it like this. Okay, TLD badge has to be worn at the level of chest like this. It has to be worn at the level of chest. So then INI-CET people ask this question, whether it should be worn inside the lead apron. I just finish. Okay, super. It should be, or whether it should be worn outside the lead apron. Okay, so Rama Subramaniam has told it should be worn outside the lead apron. Is that correct? No, you have to wear it inside the apron. Why? See, we want to measure the radiation received by the radiologist or orthopedician or cardiologist, not the lead apron. Lead apron is prone to get radiation. They can have enormous amount of radiation. Okay. It is to find out how much radiation that is penetrating and coming inside the lead apron. So, it should be worn inside the lead apron. So, that is the important question. Okay, it should be worn inside the lead apron. This is another INI-CET question. So, yeah. So I am wearing it inside my lead apron. Yeah, good, well and good. Then how much month this can be used? This will be used for 3 months. Then I have to take it out and we have to send it to Chennai or Mumbai like areas to find out the amount of radiation. So they will heat this. That is why it is called as thermoluminescent. When they heat, they will get a curve called a glow curve, and they will see how much radiation I have received. Imagine I have received a good amount of radiation because I was in DSA posting and I received a good amount of radiation. Then what will my HOD do? Then I will take this report. I will go to my HOD. I will show, ma'am, I have worked so hard in the department. I have got an enormous amount of radiation in last 3 months. Then I can ask for what? Change to USD. So you know. Actually, when I joined, I thought they will give me some leave for 1 month. Nothing. They will immediately shift you to USD where you have to do 100 or 150 USD per day. No, Ramprakash, they won't give you holidays nowadays. They found out. Okay. If they were giving holidays, what people will do? I will silently take this TLD badge. I will keep it in the pocket of a patient who is going for a CT. Expose the patient in CT. Then my graph will be like this, ping. It will be going up like anything. So they are not giving you any holidays. Instead, they will give you ultrasound posting or Doppler posting and make you keep away from radiation for 3 months or 4 months. Okay, that is the concept. Okay, now I will tell you the brain of Indians. Okay, this TLD badge, if you are going to UK, nowadays everyone is migrating to UK or Canada like areas. So if you are working there, then this TLD badge will be made up of a very good substance called as lithium fluoride. Okay, which is a very costly super substance. Okay, it is made up of lithium fluoride in abroad. When you are writing a first year exams for UK, you have to study it is made up of lithium fluoride. Okay. Since this lithium fluoride is costly, what our government did is we found an alternative. Just like Chinese products, okay, we found something which is cheap. That is calcium sulfate doped with dysprosium. In India, we are using calcium sulfate doped with dysprosium as the material in this TLD badge. So this material here kept is calcium sulfate doped with dysprosium. In this image, if you see here, there will be my name, Dr. Athul, and below that there will be that calcium sulfate doped with dysprosium here in a circle. Okay, that is what TLD badge is. So these are the questions which has been asked regarding radiation protection devices. Okay. Yeah. Now, any one of you actually interested in taking radiology? Those who are interested, at least give one hand. Okay. Anyone? There are around 130 participants. Not a single one. No one. Okay. Everyone is afraid of that artificial intelligence taking over radiologists. Is that because? Okay, whatever. Shivaramesh, yep, for AI or for becoming radiologist. Okay, whatever. So the thing is, nowadays it is a time of counseling, right? So NEET results has come. Everyone is waiting for counseling, and there is a lot of negative counseling regarding all the subjects regarding medicine, radiology, END, ophthalm, whatever you go, there will be a sort of people with the negative counseling telling that is not good or like that. And if you go through the groups, or actually we are having that what guidance program, right? Expert guidance group. I am a mentor of some students, right? So for the previous batch students, I am my group around 5 or 6 people got good rank within 2000, and some of them are going to take radiology. And their question is, most of them are telling that radiologist is a glorified photographer. Okay, so that is the comment that you will get. Radiologist is a glorified photographer, like that. Okay, so I will tell the limitation of this glorified photographer. Okay, so if you are a good photographer, what you if you imagine you are having a friend, your friend is a good photographer, what they will do, they will keep you there, they will tell you different poses like this, and they will tell you to take multiple images, and you see the image, then what you will do, you tell no, this is not good, I will delete this, I cannot put this in Insta, so I will delete this, take again, then again you will take a post like this, then again like this. So you can take n number of photos. Okay, and how these photos will be saved? So you can take multiple photos, and these photos will be saved in which format? Yeah, excellent. These photos will be in JPG or JPEG or PNG or like formats, multiple formats are there. Excellent. But we radiologists who are glorified photographers has a problem. You cannot expose the patient n number of times. Imagine you are coming to me for a CT chest. I took it first time, and I am telling you, no, you are not beautiful in this CT. I can repeat it again. Can I expose you again and again and again like a photographer? No, you can never do that. Okay, you can never do that, because the principle of radiology is to get a diagnostically optimum image, not the best image. Okay, we don't want the best image, because sometimes the patient will be having some movements, sometimes the patient will be unconscious, he will be having some jerks, sometimes they will be having some seizures or something, because when you take a chest radiographs, you will see some sort of rotation, sometimes there will be some elevation, so some problems will be there. That doesn't mean you can repeat it again and again and again. So that concept in radiology is termed as ALARA. ALARA means as low as reasonably achievable. The dose should be as low as reasonably achievable. That is the concept. Okay, you should give very minimum amount of radiation dose to the patient. You should not repeat the investigation unless it is an emergency, unless it is warranted. You can never repeat the investigation. Okay, that is the concept of ALARA. I hope you got me. And I told you, the images taken by a photographer will be stored as JPEG or JPEG format, but the images taken by a radiologist will be stored as DICOM format. The format is DICOM, just like JPEG. DICOM stands for digital imaging and communication in medicine. So any images which is taken in radiology department will be stored as DICOM. What is the use of this? Why you are not saving it as JPEG or PNG or TIFF? Yeah, excellent. It is universal. It has to be shared with others. Imagine your friend is in UK or Canada and she is getting her CT or MRI done, and she knows that you are a good doctor, so she wants an opinion from you, and she is ready to share the images with you. And we know that when you are preparing, you will not be that much good in interpreting radiology images, and you need some excuse to escape from interpreting that image. But you cannot say that this is an image taken in UK, so you cannot see that image in India. No, because that is universal. DICOM format will work anywhere, so that you don't have to repeat the imaging again and again and again. And coming to PACS, you know what is PACS, right? What is PACS? PACS stands for Picture Archiving and Communication System. See, you are a JR1 in medicine, you are ordering an X-ray chest, the patient goes to the radiology department, take an X-ray. By the time patient comes back to you, that X-ray will be visible in the monitor, in your monitor. So the picture archived in radiology department is communicated to you through networking. So picture taken anywhere. You see the today I am off because I have to teach you. So I am off from my hospital. So what these people will do? They will take the images in the morning, and what they will do? They will send it to me in the evening, so that I can go after this class. I have to go home and do these cases. So like that, these images taken in DICOM format can be sent to anyone with the help of PACS. Okay, that is PACS. I hope these three things are very important. These three things has been asked multiple times, and you should know these three things. Okay, ALARA, DICOM, and PACS. Is this clear? Or should I repeat? If you want anything to be repeated, please let me know. See, you can learn subjects like radiology, pathology, medicine from anywhere, because you will be having n number of sources nowadays. Okay, you can have any platform, you can learn from anything. But the thing is, when you are attending a session, by the end of the session, you should be thorough in the concept that is taught by the faculty. You should be very thorough in the concept that is taught by the faculty, because otherwise then it is a waste of time for you as well as the faculty. So that is the purpose of attending a live class. By the end of the class, you should be very thorough. So by the end of today, you should honestly tell me whether you have gained some amount of knowledge in radiology. Okay, and remember, only 13 pages of your workbook is pure radiology. After that, then complete entirely the things will be medicine. Okay, now coming to acute radiation syndromes. See, if you get 1 to 2 grays, your bone marrow will get affected and you will develop acute hematopoietic syndrome. And similarly, if you get 6 to 10 grays, then you will be having acute GA syndrome. And also, if you get 20 grays, you will be having acute CNS syndrome. Okay, so I will tell you what. Can you tell me one condition in which patient receives around 2 grays per day? Can you tell me one condition in which you get 2 grays per day from your knowledge? Any condition in which a patient receives 2 grays per day. This 2 grays per day is given in radiotherapy. So when you are going for radiotherapy, excellent. When a patient is in radiotherapy, excellent, very good. You will be having 2 grays per day. So the most common side effect a patient that faces will be skin erythema. That is a repeat MCQ. Skin erythema is the most common side effect. After that, there will be some hair fall and all those things. Then the bone marrow of the patient will get altered. The patient will develop all these things like fall in count, like decreased neutrophil counts and all those things. Then the patient will be more susceptible to infections. This is the concept. So marrow is one of the first organs that to get affected. So radiotherapy. So can you tell me which condition you will get a 6 or 10 grays or 20 grays? Okay, I don't know if you told in radiotherapy you will be exposed to 2 grays per day. Accepted. Excellent, Ramasubramanian. Excellent. If you have a disaster like Chernobyl, whenever there is a nuclear power plant disaster, then only you will be having this much amount of radiation. So if the radiation amount received exceeds more than 10 grays, then GI syndromes will come. If it is more than 20 grays, definitely the patient will die in 1 or 2 days, because his central nervous system will get affected. Okay, and cardiovascular system will also, CNS and CVS will also get affected, and definitely he will die. So, but that does not happen in medical level. Okay, it will never happen in a medical level. We will not give any patient 20 grays per day. Okay, we will maximum dose given will be 2 grays per day. That we will discuss tomorrow when we are discussing radiotherapy. Now coming to one of the most important tables in this chapter, that is the effects of radiation. So when a patient receives radiation, he can develop 2 types of effects. One is called as the stochastic effect, another is called as the deterministic effect. Okay, so everything we can learn with the help of the words itself, the letters itself. So deterministic means it is a dose dependent effect. It is a dose dependent effect. Okay, that is the first point that you have to understand, because when you're sitting in exam, when they ask you stochastic effect is a dose dependent effect with true or false, like that question comes, you should never get confused. Okay, that is why I am emphasizing on some words. If you remember deterministic dose dependent, then you can confidently give it as right or wrong. So the stochastic effect will be dose independent. So you might have heard that after exposing to radiation, you are prone to develop cancers. You can have a chance of developing cancers because of previous exposure to radiation. Then, cancer developed as a side effect of radiation is either a stochastic effect or a deterministic effect. Where should I classify? Whether I should put it under stochastic or deterministic? You have to tell me. Excellent. It is stochastic. I think this question has been asked around 20 times. Sorry, I wrote stochastic again. Cancer developing as a side effect of radiation is a stochastic effect. It is not a deterministic effect. I will tell you, deterministic effect means dose dependent. So if you increase the dose up to a threshold dose, there will be no side effect. After the threshold dose, what happens is the side effect will increase. First, skin erythema. After that, mucosal ulcers. Then hair fall. Then marrow damage. Then GI damage, like that. So when you increase the dose from 1 grade to 2 grade, 2 grade to 2.5 grade, 3 grades, the side effects will go on increasing like this. So this is called as deterministic effect. So this involves a threshold dose. But here, no threshold dose. Stochastic effect is a all or none phenomenon. It is an all or none phenomenon. It is an all or none phenomenon. I hope the concept is clear, because if your genes are in a state of developing cancers, definitely if you are getting exposed to a good amount of radiation, then you have a probability of going for neoplastic changes. That is the concept. Okay, it is an all or none phenomenon. So the examples of this is cancer as well as gene mutations. So all these are the things which comes under stochastic effect. And deterministic effect, as I told you, skin erythema, ulcers, hair fall, marrow changes, and all comes under deterministic effect. Okay, I hope the concept is clear. So the delayed side effects like cancer, gene mutations, etc. comes under stochastic effect, and which is not dose dependent. But that doesn't mean the dose doesn't have a role. A person receiving 2 grays and 20 grays means this person will be having high probability of developing the cancer. But this person can also develop cancer. The probability differs. But here, a person receiving 20 gray will definitely have more side effects than a person receiving 2 grays. That is the concept. Okay, just remember this table. It is very, very, very important. Okay, the table between. If you go back and see the question papers every year, you will get probably in the INI-CET exams. They will be they are more fascinated about these effects. Okay, stochastic and deterministic. So shall I move forward, or should I tell this or explain this again? Yes. Okay. So I will move forward. Thank you. Yeah. Now, in India, this is the last page of this session. Okay. So just for 2 more minutes. In India, there is an agency called as AERB, that is Atomic Energy Regulatory Board. It is this board under central government decides how much radiation a doctor who is working in radiology premises like cardiologist, orthopedician, radiologist or intervention radiologist can receive. as well as how much dose will say is safe for a public. Okay, this table is again very high yielding for exams. See, for me, a radiology worker can have 20 millisieverts for 5 years. Okay, that is the concept. I can safely receive 20 millisievert this year, next year 20, then 20, then 20, then 20, like this. Okay. Imagine if I am getting 23 millisievert this year. If I am getting 23 millisieverts this year because I am working more in DSA, is that okay for me or should I stop working? Can you tell? See, I am getting 23 millisievert. Yes. Yes means, is it okay or not okay? Reply, okay or not okay? Okay. It is okay. Because in 1 year, you can, the maximum can be up to 30, but not in 5 years. All 5 years, you cannot have 30. But 1 year, if it is going up to 30, that is okay. Maximum up to 30 in 1 year is okay. But otherwise, 20 millisieverts for 5 years is the maximum amount of radiation that I can receive. See, you are a general public now. You are not a radiology worker. You are a general public now. So, what is your safe limit? Can anyone tell me? That is the question. What is your safe limit? Because no one is worried about doctors. Everyone is worried about the public. So, what is here? Excellent. This one. See, 20 times. Let the radiologist die, no problem, because they can have 20 times more exposure. That is not a problem, but public should only get 1 millisievert. That is the concept. Okay. So, the lens of a radiologist or a cardiologist or an orthopedician can get 150 millisieverts, but for general public it is only 15. Our extremities can have 500, but for a public you should only give 50. Now, coming to a pregnant radiology or resident or a radiology consultant or a radiation worker or a pregnant cardiologist, how much she can get? Excellent. Bhavitra, okay, excellent. That is 2. Actually, that is the correct answer. A pregnant radiology worker or radiologist can have 2 millisieverts, and general public again it is 1. Fetus, everyone 1. Actually, there is no fetus in radiology, only the fetus under the mother's womb. Okay, so that is the concept. So public, so fetus is considered as a member of general public, so it is 1. So this 1 and 2 has been asked. Okay, pregnant radiologist as well as 1 and 2. This is the only questions that you have to understand. This is very important. And finally, to end this session, I will tell the most important law, that is inverse square law. I will very simply, you don't have to read and understand all the theory part. Just remember, this is the machine and this is the patient. This is the distance D. Okay, in this distance, the patient is getting 100 milligray. Okay, X radiation. What happens if I double the distance like this? If I double the distance, what happens? How much radiation then the patient will get? Any idea? The name of the law is inverse square law. So, if I double the distance, then how much radiation then? If I get 100 milligrays in D distance, if I make the distance 2D, then how much radiation then the patient will get? Excellent, Dr. Raja. Will get 25 milligrays, because the dose is inversely proportional to the square of the distance. The dose is inversely proportional to the square of the distance. So, dose is equal to 1 by, then the dose is equal to, distance is 2 means 4. Distance to, when I make it 2D, it is, when you square it, it will become 4D. So, 100 by 4 is equal to 25. So, dose decrease by a square of distance. That is the concept. It doesn't become 50, it will become 25. That is the concept. Okay. So, that is what is called as inverse square law. So, we have completed the first session.